In the world of obesity treatment, things are moving fast. The race is really on for a weight loss pill that's not only effective, but also, easy for people to stick with. So let's dive into some brand new data that compares two of the biggest players out there. Okay, so we've got two new pills on the scene. And the question on everyone's mind is, right, which one's better? How do they really stack up against each other? Well, a new analysis is giving us our first real glimpse at an answer. All right, here's what we're going to cover. We'll kick things off with this new showdown, introduce the medications, look at the actual study results, and then see what patients had to say. After that, we'll get into the fine print, super important, and then wrap up with the bigger picture. Okay, let's jump right in. A new pill showdown. We're going to unpack what this brand new comparison is telling us about the latest oral treatments out there for obesity. And let's not bury the lead here, the top-line finding. One of these pills seems to lead to more weight loss. And maybe just as crucial, fewer people had to stop taking it because of side effects. So where is all this coming from? It's really important to know. This news comes straight from a press release by Novo Nordisk. And yep, that's the company that actually makes one of the drugs we're talking about today. All right, so who are the two contenders in the ring? Let's meet the medications. In one corner, you've got the Wegovy pill. You might know it as oral semaglutide, and it's from Novo Nordisk. In the other corner, we have Foundio, which is the brand name for Orforglipron. And something to keep in mind, the dose of Orforglipron they looked at here is the same one that just got FDA approval. So this is a really relevant matchup. So how exactly did they compare these two? Well, that brings us to the Orion study. It basically focused on two main things. Efficacy, how well does the drug actually work, and tolerability, which is all about how well patients can, tolerate it. Can they stick with it? Okay, and this is where it gets interesting. You gotta understand the method they used. This was not a classic head-to-head trial where you give one group drug A and another group drug B. Nope. Instead, they used a statistical method called an indirect treatment comparison, or ITC. It's a way to compare drugs by looking at data from their separate clinical trials. All right, so what did the statistical showdown find? Let's start with weight loss. The analysis found that the Wegovy pill was linked to a 3.2 percentage point greater average weight loss. That's a pretty significant difference. But look, how much weight you lose is only half the battle, right? What about side effects? The comparison found that the chances of someone stopping the treatment for any side effect were about 4 times higher if they were on Orforglipron. 4 times, that's a huge deal. And if you drill down specifically into stomach issues, we're talking nausea, diarrhea, that kind of thing, the difference is even more stark. The odds of stopping treatment because of those GI side effects, they were almost 14 times higher with Orforglipron. Wow. Okay, so that's what the clinical data suggests. But what do actual patients think? What's their preference? Well, a completely separate survey called Optic tried to figure that out. And the results were, they were pretty one-sided. Researchers showed 800 adults 2 hypothetical drug profiles, one like the Wegovy pill and one like Orforglipron, and a massive 84% said they'd prefer the Wegovy-like profile. The survey also asked about a specific detail of taking the Wegovy pill. You have to take it on an empty stomach and then wait 30 minutes to eat. You'd think that might be a deal breaker, right? But interestingly, 65% of the people surveyed said, nah, that wouldn't really disrupt my life. Pretty surprising. Okay, now for what might be the most important part of this whole thing, reading the fine print. With any study, especially one like this, you have to understand the context and the limitations. So let's do that. And this quote from Dr. Robert Kushner really sums it up perfectly. He's saying, look, since we don't have a direct head-to-head trial, this kind of indirect comparison is the next best thing. It gives doctors and patients really important information to talk about when they're making a decision together. It's a valuable piece of the puzzle, but it's not the whole puzzle. So let's be super clear about those limitations. For that Orion study, remember, it was an indirect comparison, not head-to-head. Plus, the number of people who actually stopped because of side effects was pretty low, which means we have to be careful about those big numbers like 4x and 14x. And as for the Optic survey, they were looking at hypothetical drug profiles, not the real thing. And like any survey, you have to wonder if the people who chose to answer are different from those who didn't. And of course, no discussion is complete without talking about safety. This is critical. The Wegovy tablets come with what's called a boxed warning. That's the FDA's most serious kind, for risk of thyroid tumors, including cancer. It's definitely not for everyone, especially people with certain medical histories. All right, so we've looked at the numbers, we've looked at patient preferences, and we've gone through the fine print. Let's zoom out. What's the bigger picture here? What does this all really mean for treating obesity? At the end of the day, it really all boils down to having more information. That's what these findings are. They're new data points. They give doctors and patients more to talk about, more to consider, when they're trying to figure out which medicine is the right fit for an individual's life, their body, and their goals. And that really leaves us with a final big picture question to chew on. As we get more and more of these oral treatments and the options get more complex, how is that conversation, that really crucial shared decision between a doctor and a patient, how is that going to evolve? That's really the key question as this field keeps moving forward.